Back here, the U.S. distributor is Barbara Evans. And normally I would be honored to introduce our guest speaker tonight, and he's been up here a couple of times today. But I would not do that justice, so we've asked a very good colleague of Dr. Tennant's and the husband of Barbara Evans, Dr. Stephen Evans, who is a dentist down in the Texas area, as well as a license to practice in both Canada and the United States. And I had the privilege of meeting him a few weeks ago. And so without further ado, I give you Dr. Stephen Evans.
Appreciate it. I appreciate just the moment. You've got a jewel of a man up here that has helped so many people and myself. I've been working with Dr. Tennant since 2005. And it's been a great joy just to understand and listen in Integrative Medicine, where most people don't have that privilege. I do. I mean, he's only 100 miles away. He's kind of in my backyard. So it's been a great joy to learn from Dr. Tennant. And you'll enjoy everything that he has, and then he can answer about any question. And if he can, I've never met a man that didn't have all the answers, but he's close to it. So please enjoy Dr. Tennant. Thanks, Jerry.
Okay, does that work? All right. Well, thank you again for coming. One of the things that I need to figure out is how many of you in the audience were not here during earlier sessions today. So we have maybe half a dozen or so. Okay. Well, in order to try to accommodate the people who are hearing me for the first time, I'm going to have to ask some of the rest of you to have a little patience as I review quickly the basic concepts, because if I just start where we left off this afternoon, well, people will be completely lost, I think. Oh, just in case. Thank you very much. I assume I need to read this little sign again. AGD disclaimer. I do have a financial interest in a product in my talk or with a company offering grant monies for this continuing dental and medical education program. As most of you might guess, the device that carries my name means I have some interest in it, and so there you have it. Okay, healing is voltage. I wanted to make particularly the new folks aware how I came to be talking about this subject. I am trained as an ophthalmologist, and I did a residency in ophthalmology at a combination of Harvard Medical School in Boston with Mass Eye and Ear and Southwestern Medical School and Parkland Hospital in Dallas between 1964 and 1968. So I'm board certified in ophthalmology. I'm also board certified by the American Society of Ophthalmic Plastic and Reconstructive Surgery, and I was the director of the Ophthalmic Plastic Surgery Division at Parkland Hospital for a number of years, primarily putting faces and skulls back together from trauma. I was the founder and director of the Dallas Eye Institute. I have a Doctor of Natural Medicine degree from the Pastoral Medical Association. I'm licensed in Arizona by the Board of Homeopathic and Alternative Medicine. I have patents in medical devices such as intraocular lenses and surgical instruments. Along with a couple of my friends, we started the Outpatient Ophthalmic Surgery Society and taught ophthalmologists around the world how to do outpatient eye surgery in the 1980s. I was one of the first people in the United States to put lenses in eyes after cataract surgery and taught those techniques around the world. It may be of some interest and give you a chuckle to know that I was fired from my teaching position at the medical school because they said anybody who was so stupid as to put lenses in eyes after cataract surgery had no business teaching residents. And of course now it's malpractice not to put them in. So things do change over time. I've received a few awards for the things I've done. I received the Corboy Award for Advancements in Ophthalmology, the American Academy of Ophthalmology Award for my contributions. I've written a few books about cataract surgery, lifestyle management, and that sort of thing. And a few years ago, I was honored to receive a call asking if I would accept an award from the Pope, which surprised me a great deal since I'm not Catholic, but I was honored to receive it as well. So I received the Order of St. Sylvester for my contributions to medicine. Thank you. I have an honorary PhD from a university in Spain, and I currently have a clinic in the Dallas area where I practice integrative medicine. And so that's how I got started doing this sort of thing. Now, my journey began really when I started doing the study for the FDA using the Vissec excimer laser, which is used for LASIK surgery. And I had a lot of fun doing that. We did 3,000 cases. I did 1,000 cases in Dallas, and I did 2,000 cases here in Vancouver. You may wonder why that was. The rule the FDA had was that we could do one eye, and then we had to wait a year before we could do the second eye. So you can imagine if somebody had Coke bottle glasses and we got this eye perfectly normal and this one is still this thick, they were totally dysfunctional. But we couldn't do anything about it in the States, so every month we would load up an airplane full of people and bring them up to Don Johnson's clinic here in Vancouver and treat the second eye. So I got to come to Vancouver every month for about a year and a half until we finally got past the FDA's nonsense. So one of the things that happened was that we didn't know at the time that the laser would not kill viruses. And so the laser would tap on the cornea of the eye, exploding cells and removing tissue, and it would release viruses, and those viruses would come up like a plume off of an atomic bomb, came up and went through my mask, through my nose and into my brain, and so I developed both encephalitis and a bleeding disorder. Now, some people get confused with my story because I would not have been able to get into that trouble had I not had low voltage in my brain to begin with and in my spleen to begin with. The only reason those viruses were able to have their way with me is because I had a root canal in number 14, which is in the spleen-stomach meridian, which had lowered my voltage in those areas of my body, allowing the virus to have their way with me. So what happened to me is that I got to where I could see a patient, know what was wrong with them, but I couldn't remember how to write a prescription. And so I would see a patient and I'd have to go sit in my office and maybe sit at my desk for 10 or 15 minutes trying to get enough energy in my brain to remember how to write the prescription or what I needed to do. In addition, I developed spastic movements, which doesn't work well if you're operating inside an eyeball. So for all of those reasons, I had to quit work at the end of November of 1995. And here's how I spent most of my time. Now, you may recall that I had viruses in my brain and viruses in my spleen. This is Tigger, this is Pooh. Tigger would always come and lay on my head. Pooh would always come curl up next to my spleen. So it was obvious that they knew where my problems were, and I consider them the original biomodulators. So I feel owe my life to integrative medicine. I was told that I would develop Burkitt's lymphoma and that nothing could be done about the multiple viruses that they found in my system. And my blood profile kept getting worse and worse, and so it looked like the end for me might be the summer of 1999. But obviously that didn't happen since I'm still here. Now, these are photos taken. This was at Christmas time in 1999 when I was 59. This is taken at Christmas time in 2005. This was taken just this past Christmas. And I'll be 74 in June, the end of June of this year. So just 2 or 3 more months, I'll hit the 74-year-old mark. And I hope you can tell that I'm better off here than I was back here. And so what I'm trying to share with you is the things that I learned how to do in order to regain my health and get back to being productive. One of the reasons I survived this was my sweet wife, Marilyn, who is sitting back in the back someplace, I think. Anyway, there she is someplace. And there she is over there. Marilyn not only was taking care of me, she was taking care of both of my invalid parents. So she had 3 of us to tend to all of this time. And I'm sure I wouldn't have made it through without her. So every opportunity I get, I salute her and thank her for sticking with me through all the bad years. So I want to try to share with you the things that I learned, and I'm still learning about how the body works. The things that I've learned are totally different than the way I was trained in medical school. And so I make it every effort. It's my mission in life to go out and try to share with people the things that I learned that helped me so that others can be helped as well. Now, my journey actually began when I got these 2 Polaroids in the mail. This lady was a nurse and a friend and a patient who lived in the Dallas area and developed lymphoma. She had this tumor around her neck. She had one in her left axilla, one in her spleen, and one in her left kidney. She had been to MD Anderson Cancer Institute in Houston and received multiple rounds of chemotherapy and radiation. And they told her there was really nothing more to be done for her, to go home and put her affairs in order. Instead, Janet decided to go to Mexico to see if she could get some help. One evening, she and her husband were in a restaurant, and they met another Caucasian, namely Dr. Bob Vance from Las Vegas. Excuse me. Now, Dr. Vance obviously knew immediately what was wrong with her and said to her, "Why don't you come to our clinic? Lymphoma's a piece of cake." And she thought, well, not with what all I've been through, so she declined. But then a few evenings later, this tumor around her neck was choking her to death. She was going in and out of consciousness, and she told her husband that if she lived through the night, that tomorrow she wanted to go see Dr. Vance, and that's when this photo was taken. This was taken 3 weeks later when she was on her way back to Dallas. And so when she got back, she went back to MD Anderson and had a workup again, which showed she was completely free from her tumors. And she sent me her medical records so I could actually read the real records rather than just hear her talk about it. So when she did this and sent me these photos and this information, I asked my wife to take me down to see Dr. Vance, and that was where my journey began. So what I'm going to try to do, or what I've tried to do throughout this day and continuing this evening, is try to change your paradigm. Now, I admit at the start that it's very difficult to change paradigms. You know, a paradigm is what we learn. We start being taught by our parents when we're quite small, by our friends and our teachers and others, and eventually we have to have a set of beliefs. And when someone says to us, what you believe isn't true, it's very difficult for us to change, isn't it? And it's perhaps more difficult for physicians than anybody else. We get so thoroughly brainwashed in medical and dental school that we know how things work, that when somebody says to us that we don't know what we're talking about, we are ready to commit you to the closest insane asylum because obviously you're confused. Well, the reality is that much of what we have been taught in school is incorrect. And the paradigm under which people in North America live in medicine is that basically if the body isn't functioning correctly, we have to find a chemical that will get rid of the symptoms, namely a pharmaceutical. And if that doesn't work, we remove surgically the offending part and throw it away. And if that doesn't work, we're out of bullets. Well, what happens is you go to your doctor and you say, "Doc, it hurts here," or "Doc, I'm tired all the time," or "Doc, I can't sleep," or "I can't think anymore." So the doctor orders a complete blood count, metabolic profile, urinalysis, and a few other tests, sometimes some x-rays or electrocardiogram. And when all of those come back normal, the doctor says, "Well, there's nothing wrong with you. All your tests are normal." And you say, "But Doc, I can't work. I can't get out of bed in the morning. I can't think. I forget everything. I hurt here, whatever. He says, oh, you're just depressed. Here, take these antidepressants and some pain pills. And if you have a fever, you get some antibiotics, and out the door you go. That's modern medicine. Well, the reality is that isn't working well at all. The medical outcomes in the United States are rated by the World Health Organization as 36th in the world, just above Cuba. So medical care in the United States is not working well because, in my opinion, it's the wrong paradigm. God didn't make a human that was deficient in antidepressants. He didn't make a human that was deficient in antibiotics, didn't make a human that was deficient in all of these various things. So that's really not the way we were designed, nor the way things really work. So I'd like to suggest to you a different paradigm. This different paradigm recognizes the fact that we are constantly wearing ourselves out. So we get new cones in the macula of our eye every 2 days. The lining of your intestine is replaced every 3 days. The skin you're sitting in tonight is 6 weeks old. Your liver is 8 weeks old. Your nervous system's 8 months old, and so forth. So we're constantly wearing ourselves out. In addition, if we have trauma or if we have infections, those damage more cells that we have to replace. So the paradigm I'm proposing is that chronic disease only occurs when we lose the ability to make new cells that work. So let me say that one more time. Chronic disease only occurs when we lose the ability to make new cells that work. And as long as we can make new cells that work, then as we wear ourselves out, as we have injuries and our traumas or infections, we simply make new cells and we're well again. So in the traditional way of thinking of things, we have the autonomic nervous system, we have nerves which supply motor for movement and sensory for sensations, we have blood which supplies raw materials and oxygen, etc. But I think what's missing from that paradigm is the voltage piece. Because every cell requires energy to work. And that should come as no surprise, right? It makes sense that we have to have energy to work. Yes? Sure, well, actually, I don't think there's room for that up here. We could try it. That would be nice. Thank you. Yeah, that way if I begin to crumble, I won't fall off the stage, right? All right, thank you very much. That's very kind. So, what we're going to be looking at is what does it take to make new cells. Now, I know that you can't read all of this diagram, but that's fine. It just shows you the pieces that are necessary to make new cells. Because if you believe, as I do, that chronic disease occurs when you lose the ability to make new cells, then that we must ask the question, well, what does it take to make new cells? Well, first of all, cells, as I'll show you, are designed to run at 25 millivolts, but to make a new cell, we have to have 50 millivolts, so we obviously have to have the energy to make the cells. Then we have to have the raw materials that make cells, and we'll go over those as we go through our time this evening. So, one of the things that becomes possible is that when you look at something like this, you can automatically know what caused it. When you, I know this may not make sense to you at the moment, but hopefully by the time the evening's over, if this person, if you saw this person sitting at the next table to you at the restaurant or came into your office if you're a physician, you could look at that and say, oh, I know what caused that. Obviously, this is a skin cancer, right? Well, can anybody tell me what caused this skin cancer to occur? Yeah, you can only get cancer when your voltage drops to plus 30 millivolts, which means it's flipped its polarity. So what circuit is that on? Then you have to ask, what is the power supply to that circuit? And here we go. As you can see, this is in blue is the power supply that's called the stomach meridian. And you can see that this tumor is exactly on that little band that goes from the orbicularis around the eye and the orbicularis around the mouth. See the little band? That's exactly where this tumor is. So this tumor could not be there except for the fact that the spleen's acupuncture circuit has dropped to plus 30 millivolts. Can't happen otherwise. So that makes it easy, doesn't it? So then all you have to do is ask the question, well, why did the spleen circuit drop to plus 30 millivolts? And almost always the answer is going to be a dental infection. Almost nothing else will drop the voltage of a circuit and change its polarity. There are a few other things. Radiation will do it. Pesticides will do it. Petroleum products like benzene, wading around in benzene will do it. Smoking will do it. There are a few things that will do it. But almost always, when you find a malignancy, you will find that if you ask yourself, what is the power supply to the area where the malignancy occurs? And once you identify the power supply, you'll know exactly what the origin was. Same question here. Obviously, you have a breast cancer, right? What causes that? Well, as you can also see, the power supply to the breast is exactly the same circuit as the one I showed you before. And so the only thing that will allow a breast cancer to occur is to drop the voltage to plus 30 millivolts in that circuit that provides it power. And so it becomes very easy to see that you will find, almost always, you'll find an infected tooth in that circuit. I did a little study a few years ago. I went to an oncologist's office 2 different weeks, and we looked at his cancer patients, and what we found was that 70% of his cancer patients had a root canal in the same acupuncture meridian as his primary cancer, and 30% had an infected crown. So in that group of patients that we looked at, there was 100% correlation between an infected tooth and the acupuncture meridian in which the primary cancer occurred. And the mean time from the dental procedure to the cancer was 7 years. Since I figured this out, I've seen now 7 patients that had a malignancy where I could not find a dental connection to it. And in those cases, you always found the things that I mentioned: smoking, radiation, pesticides, etc. So it becomes easier for you to begin to recognize what's causing something when you begin to think like an electrician instead of like a physician. Because it's really all about the voltage, because what is constant in people who have chronic disease is that the diseased organ or organs, when you measure it, will always have low voltage. And then you simply ask, well, why is the voltage low? Well, I'm going to skip past a few things here, and I want to just, while we're just mentioning the subject of malignancies. Sure. It's very rare to find a person who has a root canal that doesn't have low voltage in that circuit. Can it happen? Yes. But is it uncommon? Yes. So most of the time, the circuit, a root canal will take the voltage down in that associated circuit. Which should be no surprise. You know, there's a study from Kentucky showing that one root canal shuts down 63% of your immune system. So it should be no surprise that that's what you find, is that root canals simply take down the circuit. The thioethers that come out of them are so toxic that they're going to really decimate the voltage in the associated circuit, which is exactly what happened to me, right? One root canal put me in bed for 7 years. Now, if you look at just cancer statistics, these are statistics that from the American Cancer Society, and they show the incidence of malignancies from 1930 to 2002. And you can see this is for males, and what you see is that the incidence of stomach cancer has gotten less. The incidence, though, of lung and bronchial cancer has gotten much worse, but everything else has stayed about the same. So there's been really very little difference in the amount of people dying from cancer or the incidence of cancer since 1930. And the data for females is very much the same. So as you can see also for females, lung and bronchial cancer have gotten worse. The uterine and stomach cancer have gotten better, but everything else is about the same. So why is it that we hear statistics that some cancer treatment has an 80% success rate or something? Well, it depends on how you define success. In those studies, they say that if at any point in time the tumor got smaller during the treatment, then you go into the cured column. Even if you die the next week, you still stay in the cured column. Well, if you define cure like that, you can get these funny numbers. But the reality is that things really aren't changing much. Now, here are the trends in the number of cancer deaths among men and women from 1930 to 2006. And what you see is that everything keeps getting worse and worse. So not so long ago, I was seeing on TV where they were telling us that more and more people are living with the diagnosis of cancer. Yeah, it doesn't mean that our cure rate's any better, it just means that more people have cancer. See the problem? You can spin it and say, we're doing such a wonderful job treating cancer, but we're not. The reduction in cancer from the American Cancer Society statistics show that the absolute reduction was 0.0023%. So the reality is that we're not doing a very good job in dealing with malignancies because we're using the wrong paradigm. Well, I'm not going to spend a bunch more time talking about that subject. I wanted to really get down and talk to you a bit more about how things work as far as the voltage part is concerned. By the way, you might find this part fascinating while we go past this. It has been long believed by most people that you are stuck with the genes you got from your parents. But the reality is that that's not the case. The wheel began to come off that wagon with the publication of this paper called The Origin of Mutants by John Cairns. John Cairns was a geneticist from the UK who also did a bunch of work in New York. What Cairns did was to take bacteria that were missing the gene to use the sugar lactose, and he put them in a broth that only had lactose in it. And what he found was that the bacteria began to thrive. They could have only have done that by altering this genetic mutation so that they were able to survive in the environment in which they found themselves. Well, when Cairns published this paper, his colleagues said, too bad about old John Cairns. You know, obviously his cheese has slipped off the cracker, but he's talking about genes changing. But when they did the same experiment, they got the same results. And so what Cairns taught us was that our genes change according to our environment. And it's since been shown that it's not only according to our environment, but our perception of our environment allows us to change our genes. And then Waterland and his group did this nice study. These mice, called agouti mice, are fat and golden, but if you give them folic acid, B12, choline, and betaine, which, by the way, are the things you need to help methylation, it changes their genes so that all their kids, grandkids, and great-grandkids are skinny and brown. So we can permanently change our genetic makeup by changing our diet. So what we've seen between the two of those is that none of us have the genes we were born with. Our genes have changed throughout our lifetime according to our environment and according to our diet. Now, of course, the Genome Project, which was of some interest, also taught us some additional things, and that is, it was assumed that because there are about 120,000 proteins in the body, that we had about 120,000 genes, one for each protein. And that if we were able to map out all of those genes, we would find the cause for all diseases, and we'd be able to find drugs that cured all diseases because they would change our genetic makeup. Well, to everyone's surprise, when the Genome Project was finished, we found out that the human only has 25,000 genes. So here you can see my wife and my daughter, each of whom has 25,000 genes, and a tulip that has 26,000. Now, this is not a disparaging remark about my family. It's an observation that there's something going on here when someone that's as intelligent and wonderful as a human has fewer genes than a flower. And so this has led us to understand what's called epigenetics, which means that for each gene we have, there are things that are around the genes that change the way they're expressed. And that change in expression accounts for the fact that humans can do amazing things that flowers and other things can't do. And even a yeast cell has 6,000 genes, a fruit fly has 13,000, and a worm has 18,000. Now, clear back, surprisingly enough, in 1957, Howard Tiemann got a Nobel Prize for showing that our genes change and that they change according to our environment. Well, one of the things that I wanted to next discuss with you is the issue of regeneration, which fits in with some of our conversation a couple of hours ago about making new teeth, growing new teeth. Now, you understand that the concept of healing is different from the concept of regeneration. Healing is that you have an injury and you are able to repair it. Regeneration means that you have an organ that has failed you and that you're able to regrow a new organ. So some of the early work about regeneration was done by Robert Becker. Becker was an orthopedic surgeon who wondered why it is that when the human loses a piece of bone, they grow more bone. But when the human loses anything else, they simply replace it with scar tissue. On the other hand, there are animals like the salamander, which has the ability to grow new body parts. So even though the salamander has all the same body parts as a human, if you cut off a salamander's arm, he simply grows a new one. You poke out his eye, he grows a new one. You cut off part of his heart and he grows a new one. So Becker wondered, why is it that salamanders can do that and humans can't? So Becker began to study them, and what he found was that salamanders normally run at around a minus 10 millivolts, minus 10 millivolts, compared to the human that runs at 25. But when you would amputate the arm, the voltage would quickly drop down to about plus 25 millivolts, and then on the sixth day it would go up to nearly double or triple, up to around minus 30 millivolts, and then the salamander would start growing a new arm, and 2 months later he'd replace the amputated arm. So that the progress of growing a new arm was related to what was going on with the voltage. Now, one of the interesting things happened, and that is that when you get out about 6 days or so, at the end of the stump shows up a wad of stem cells. So Becker found that if he amputated an arm and then he waited 6 days and he retrieved those stem cells and made an incision in the top of the head and stuffed them in there, the salamander would grow an arm out the top of his head. If he put it beside his hind leg, he would grow another hind leg. And so he was curious as to about how it was that these cells knew what they were supposed to grow. So he began to suspect that it must be the nerves, and so he would go in and cut the nerve going to the arm before he amputated it, and it didn't change anything. So the pattern of regrowing stayed the same. Eventually, what he discovered was that the information and the programming of what was to grow was being brought into the system by the acupuncture meridians rather than the nerves. And so that the stem cells got their programming from the acupuncture circuits. Now, here you can see a picture of a salamander whose arm has been amputated. You can see the bone here. You can see the muscles have retracted a bit. The skin's retracted a bit. Here are the muscles back here. And then here you can see at 18 days the stem cells that have collected at the stump. And here you can see at 42 days those are now turning into a hand and arm, and then by the end of 2 months the arm is completely regrown. So that's regeneration. Now I want to show you a couple of other examples. I've been given permission to show this picture of a researcher's father who, due to an auto accident, has been unable to use his legs for a number of years and has been in this wheelchair. And he had a hemorrhoidectomy, and his surgeon told him that he would be more comfortable and it would heal faster if he would sit on a heating pad, and you can see it simply burned all of the skin off of his bottom. And so they took him to Brooke Army Burn Center in San Antonio, and they said, well, it'll take a year and a half or so to recover, to grow this back. Well, I was lecturing with this physician in Phoenix, and I said, hey, you need to look at this picture I'm going to show you about a burn and how it healed amazingly well with the application of the voltage. And he was so excited about it that we loaned him a biomodulator and a biotransducer, and this is how it healed 3 months later. And so this, of course, is an example of how of actual regeneration rather than pure healing. Now, this movie that I'm about to show you here is a movie from Dr. Mark Starr. Many of you know Mark. He's a famous physician about thyroid. I don't have sound capability, so I'll have to monitor this for you as we go. I got a call from Mark one evening. He said, hey, Jerry, I burned my thumb a little bit. You have some recommendations? I said, well, sure, yeah, I'll just put some voltage in it and use the humic and fulvic, and you should be fine. Little did I know that he had such a terrible wound. Most of you would agree that when you see something burnt like this, that the end result is either going to be amputation or simply a stick of scar left over, right? Well, let's see if I can encourage this along a little bit. Maybe not. So, what Dr. Starr did, and hopefully this movie will move along and show you, if I can't tell that it's even moving, let me do it a different way. Let's go here and desktop and let's see. There it is. So what you'll begin to see is that he took this thumb and put it and began treating it with a biomodulator and soaking it in aloe vera and then soaking it in humic and fulvic, which we call raw materials. And that here you can see that. Oh, you're not seeing what I'm seeing, are you? Oh, sorry about that. I don't know why in the new system with the new Mac software that the only time it will send it out to project it is through an HDMI cable. It won't send it out through a VGA for some reason. So, never mind. Basically, then, what happened is that this thumb started out in this disastrous way. And what he did was to stick it down in a glass full of humic fulvic and then use the biotransducer to shine down in on the thumb. And in 3 weeks' time, he had basically grown a new thumb. His thumb's perfectly normal now. So it's a great example and demonstration. And if you go on my website, you can watch this movie that I'm not able to, for technical reasons, show you tonight. But he completely regenerated this thumb in 3 weeks' time by simply correcting the voltage and supplying the raw materials through the humic fulvic process in order to make himself. It is going. Unfortunately, we don't have sound, so you can listen to his voice, but nevertheless, we'll just let it sit here and run for a minute, and you can get an idea of what he did. In addition, do you have some? So I just wanted you to see that this whole business about regeneration is directly related to voltage and having the appropriate raw materials to make new cells. And so as we move forward in our understanding of how stem cells work, we will, I'm certain, see that voltage is a key player. One of the things I wanted to share with you tonight also is this amazing bit of information from Johns Hopkins called The Illusion of Certainty, Health Benefits and Risks. Anyone who reads medical studies should be aware of this book and what's going on with our medical journals. Now, for the majority of my career, medical studies were reported as what's called Kaplan-Meier technique. So what you do is you take one group of people and you give them whatever you're wanting to study. Let's say you're trying to prevent heart attacks, and you give another group the placebo, and at any point in time you can compare the two groups and you can see what number of heart attacks occurred in the people who are getting the active drug and how many occurred in the group that were getting the sugar pills, Kaplan-Meier. Well, beginning about 15 or so years ago, it all changed. And all of the medical journals began to report in what's called relative risk. So it took me a long time to find out what relative risk really meant, and even when I talked to different statisticians at the universities, they really couldn't explain it to me until I didn't really understand it until this book came out from Hopkins. So here's the way it works. Let us assume that 6 people out of 100 have athlete's foot. And so you give them green jelly beans, and now 4 people out of 100 have athlete's foot. So what is the absolute risk reduction? 2%, right? We went from 6% to 2%, to 4%, which is a 2% reduction. Unfortunately, that will be reported in a medical journal as a 33% reduction because 4 is 33% less than 6. You understand what I just said? So in the journal, it will be reported as a 33% reduction. Now let's assume that we have 6 people out of 10,000 and you give them a drug and it drops to 4 people out of 10,000, it will still be reported as a 33% reduction, even though the real number is 0.000 however many out there to 10,000, right? You understand the difference? So the bigger the study, the easier it is for them to lie to us about the effectiveness. So unfortunately, essentially all medical studies now are reported that way. And so you don't have any idea of whether or not the therapy that they're trying to talk to you about was effective or not unless you go back and actually read the numbers in the study and do the math yourself. And that is the reason that they were able to convince us that cholesterol had something to do with heart disease, which it doesn't. So this group at Hopkins decided, let's make it visual. And so here is a diagram of a theater with 1,000 seats in it. Here is the annual deaths per 1,000 from heart attacks as compared to mean cholesterol. So you can see that here, if your cholesterol is 150, that then you have 2 deaths per 1,000 at that level, whereas if the cholesterol level goes all the way up to essentially 300, that you have 2 per 1,000. So how does that graph out? Well, out of 2,000 people with elevated cholesterol, there will be 1 additional death each year from coronary heart disease compared to 2,000 people with normal cholesterol. And that's this one little guy here sitting in 2 theaters with 2,000 seats. Kind of impressive when you look at it from a visual standpoint, right? So what it means is that for 99.95% of the population, you will not benefit from any effort, diet or drugs, to reduce blood serum cholesterol levels. To put it another way, for 1,999 out of 2,000 individuals each year, it makes no difference whether you have elevated cholesterol or normal cholesterol in terms of whether or not you develop coronary heart disease. Did you know that? So why is it that when you go to your physician, your physician will almost have a stroke if you tell them that you don't want to take statin drugs? And many times patients come to me and said, well, I told my doctor I didn't want those drugs, and he told me to get out of his office and not come back. I hear that over and over again. Physicians are so aggressive about trying to make people take cholesterol drugs when the literature shows that they're totally ineffective. Well, how about the H1N1 flu? You'll remember that this H1N1 flu was proposed to be so dangerous that they activated the Patriot Act in order to force people to be vaccinated. Did you know that? Patriot Act. Well, if the current trend continues, 2,000 Americans will die from H1N1 flu in a year. This would be equivalent to 0.00667 deaths per thousand. That is no darkened seats in one theater. The forecasted 2,000 deaths in the U.S. over 1 year is equivalent to 6 deaths per million. That is 6 seats in 1,000 theaters. 2,000 deaths in the U.S. over 1 year would be equivalent to 1.6 deaths per 10,000 over 25 years if the outbreak continued at the same rate for a quarter of a century, which is 2 darkened seats in 10 theaters. This was the big pandemic. Now, if you look at smoking, of course, it's a whole different story. It becomes obvious that smoking is a problem, right? And, of course, mammograms are the same problem. The studies out of Sweden show that for women who have mammograms every other year for 15 years, the incidence of death from breast cancer is multiplied by 6. So you're 6 times more likely to die from breast cancer if you have a mammogram every other year than if you don't. Did you know that? Can you guess why? Radiation's not particularly good for you, right? So, now, the other thing that I wanted to show you that goes with this is an issue about cholesterol. Let's see if I can find those slides. There we go. All righty. So there are many people who believe that you can't get well from chronic disease unless you are not aware that you can't get well from chronic disease if you don't need enough fat to make new cells. And the problem is you don't want to eat fat because you think eating fat will make you fat, which is false. You think that eating fat will give you heart disease, which is false. Your doctor will try to convince you to eat a low-fat diet, but you can't make cells without eating 20% of your body weight in fat every 8 months. Now, in the 1920s, a cardiologist in Boston named Paul Dudley White bought the German electrocardiogram machine to Boston to show his colleagues. And they said, well, Paul, that's all very interesting, but why are you wasting your time with an electrocardiogram? Nobody has heart disease. That was 1920s. So obviously something happened between then and now, right? Well, what happened is that as people began to have heart attacks and they did the autopsies, they found these plaques in the coronary arteries, and within the plaques they found cholesterol. And so they made the assumption that somehow cholesterol was causing the plaques and therefore causing heart disease. Well, the problem with that is that you can prove statistically that flies cause garbage. Just because something is there doesn't mean it caused it. And as you'll see, all scars contain cholesterol, fibrin, and calcium. So that a plaque in a coronary artery is simply a scar. But nevertheless, the theory was formed that cholesterol caused heart disease. Well, from 1990 to about 1950, an elevated cholesterol was considered diagnostic of hypothyroidism. But after the TSH test was developed, cholesterol was forgotten as in its role as it relates to hypothyroidism. But what you'll see when you look at a plaque is that the plaque itself inside the artery is simply the tip of the iceberg, that all of the problem is really out here, and we'll come back to that as we go forward. What I'm going to show you is that our traditional medical literature does not support the theory that cholesterol and saturated fats cause heart disease. So how did doctors and therefore their patients become so confused to believe that eating fat causes heart attacks? And how did doctors believe the myth that lowering cholesterol with drugs helps patients live longer and better? Well, it all started with the writing of Ancel Keys. Dr. Keys was a physiologist who, in 1956, said, in the adult man, the serum cholesterol level is independent of the cholesterol intake over the whole range of human diets. What he's saying, as that has been well known, is that the liver makes as much cholesterol as it thinks you need, and the amount of cholesterol you eat has essentially nothing to do with the cholesterol levels in your blood. So when you go to the grocery store and it says, low cholesterol, buy me, that's marketing, that's not science. It has nothing to do with your cholesterol levels. Now, Ancel Keys got a job working in Minneapolis, St. Paul area, and he published nearly 100 papers between 1985 and 1995 convincing doctors that cholesterol causes heart disease. In 1993, he said, it can be concluded that this study suggests that mean serum cholesterol is the major risk factor in explaining cross-cultural differences in coronary heart disease. And he quit that job, and in 1997 he said, there's no connection whatsoever between cholesterol in food and cholesterol in the blood. None, and we've known that all along. Well, Keys published this thing called the 7-country study. And what they did was they looked at the amount of fat eaten and the number of heart attacks in these 7 countries in 12,000 subjects. And here's the data that he published over here. What you see is that according to the data that he published, that the more fat you ate, the more heart attacks you had, and it was worse in the United States and Canada than it was in other countries. Unfortunately, Keys lied to us because this is the real data. He simply cherry-picked it to make his point. What the real data showed was the more fat you ate, the fewer heart attacks you had. But in spite of the fact he lied to us, his study was influential in beginning to get doctors to believe that cholesterol caused heart disease. Well, the next study to finally convince doctors that cholesterol was the cause was the 4S study from Scandinavia. Now here's the Kaplan-Meier study technique that I showed you a while ago. You have a control group and the treated group, and at any point in time you can compare how many heart attacks occurred in the treated group versus the control group. But they began first reporting studies as what's called Cox proportional hazard model, which gave us what was hazard ratio, and then there would be a decimal place here, parenthesis, confidence interval of 95%, and then 2 more decimals. This first decimal is the mean of those. So this decimal here is the mean of these. Well, what would happen is that drug salesmen would come in and say, look, if you use our drug, 50% of your patients won't get heart attacks. Well, that's not what that means at all. What you have to do is that you have to take this number and divide it by 1 plus that number to get the probability that treatment works. So what you see is that a 0.5, which is in this example, means there's a 33% chance or likelihood that the treatment worked and a 67% likelihood it didn't work. That's completely different than saying take our drug and 50% of your people won't get a heart attack, right? What you see is with this methodology that this number has to be over 1 for there to be, if it's exactly 1, there's a 50-50 chance that the drug worked and a 50-50 chance it didn't. So if you look at what they did to us with the 4S study, which here you can see it, the relative risk of death in the simvastatin group was 0.7, which if you go back over to this thing, you see that 0.7 means there's a 41% chance that the drug worked and a 59% chance it didn't work. You see that? But what the authors concluded in the 4S study, they said this 42% reduction in heart attacks means that people should be on statin drugs. Isn't it amazing they let them publish it that way? So again, they lied to us about what this study really meant. And so if you look at all of these different studies that have been published, here you see the Framingham Heart Study, which showed that the death rates are unchanged from cholesterol levels of 205 to 264, and that levels lower than 205 are associated with increased death from cancer and other diseases. So here you can see that it doesn't matter whether you take in 43 milligrams or 925 milligrams of cholesterol, that it doesn't change your blood cholesterol one bit. And what they found in this study after 40 years was that the more saturated fat one eats, the more cholesterol one eats, the more calories one ate, the lower the person's serum cholesterol. So if you eat enough fat to provide the things that you need to make hormones, then your liver doesn't make excess cholesterol. We found that the people who ate the most cholesterol, ate the most saturated fat, and ate the most calories weighed the least. Okay? So eating fat doesn't make you fat. And we're the most physically active. Well, how about other studies? Here's the Tecumseh study showing that it doesn't matter how much cholesterol or saturated fat or total fat you eat, it doesn't change your blood cholesterol one bit. Which means that you can eat as much saturated fat like red meat, coconut oil, palm oil, eggs, and so forth as you like, and it doesn't affect your blood cholesterol one bit. Now, there are only 2 studies that I can find that studied the effects of eating animal fat on coronary heart disease itself. This one, published in JAMA in '66, had 2 groups. One group followed the so-called prudent diet with corn oil and margarine instead of butter, breakfast cereals instead of eggs, and chicken and fish instead of beef. And a control group ate eggs for breakfast and meat 3 times a day. How did it turn out? The corn oil, cereal, chicken, and fish group had 8 deaths. The butter, eggs, and beef had none. Here's the other study from the British Medical Journal, published in 1965. One group got polyunsaturated corn oil, the second group got olive oil, and the third was told to eat animal fat. Here's how it turned out. In the patients who'd already had a heart attack, eating animal fat instead of corn oil cut the risk of death from 24% per year to 12.5% a year. Go figure. Well, there are several reasons that cholesterol cannot be the cause of heart disease. One of them is they talk about good cholesterol and bad cholesterol. The idea is that bad cholesterol causes heart attacks. You've heard that, haven't you? Well, if bad cholesterol causes heart attacks, then everybody who has a heart attack should have a high level of bad cholesterol, wouldn't you think? The reality is that 50% of people who have heart attacks have low levels of LDL, so-called bad cholesterol. 50%. So it's obviously can't be the primary cause if half of the people who have heart attacks have normal levels. Well, another problem is that LDL cholesterol won't go through the artery wall. You can't make it go through. If you could make it go through, then the plaques in your arteries should be evenly distributed throughout the whole artery, shouldn't they? They aren't. They're concentrated where arteries branch, where the wall of the arteries are weakest. Well, here's a study that was done in Pittsburgh where they looked at angiograms where you could actually quantitate the total volume of plaque in coronary arteries. And then they tried to relate that to all known components of cholesterol. And what they found was that there was no relationship whatsoever between the volume of plaque in a person and any known subset of cholesterol. And so one of the interesting things about the classical risk factors from the Framingham study is that they are high cholesterol, high blood pressure, diabetes, and smoking. Well, high cholesterol, high blood pressure, and diabetes are all associated with hypothyroidism. So basically what they're telling us is that the classical risk factors are hypothyroidism and smoking. Now, back in the 1970s, the world expert on hypothyroidism was, just a minute and I'll tell you his name. I'm just having a senile moment here. Say it again? Rhoda Barnes, thank you. So Barnes looked at about 4,000 to 6,000 autopsies. He did a lot of work. And what he published was that in patients where the thyroid was adequately corrected, the incidence of heart attacks was 0.26%. Amazing, right? 2 or 3 weeks ago, Mark Starr from Phoenix published a new book in which he shows that in his 15 years of treating thyroid disease, that if you had the thyroid normally corrected, there was only one heart attack, and it was a patient who refused to give up smoking. Only one out of all of that he's treated. So what we began to see is that one of the main ways of preventing coronary artery disease is to adequately correct thyroid hormone. And for those of you who were here at the question and answer session between 5 and 6 o'clock, we discussed how the labs that the normals that are being printed on our labs are 10 years out of date, and thus many people aren't being treated adequately. Well, if we look at the other studies about statin drugs, here's the heart protection study with 20,500 people, and here's the results. As you can see, the absolute risk reduction was only 1.2%. And here's the study on Lipitor and in what was called the Miracle study. And here's the All Hat study. And so when you look at all of these studies with thousands and thousands of patients, here's what you find. Here's the name of the study. Here's the drug name, the trade name, the number of patients, the percent, the treated percent, the placebo percent, and the absolute reduction. So what you see is that in almost all of the studies, the absolute reduction in coronary heart disease is between 1.1 and 2.6%. Now, any of you who have done studies know that you can get those kind of changes just because of sloppy record keeping, right? It's very difficult to keep completely 100% accurate records when you do these studies. But again, what we were told you earlier is that lowering cholesterol by any means, including these drugs, is only effective in one person out of 2,000 and making any difference about whether they have heart disease or not. So in spite of the fact that these drugs have very little benefit, what about their side effects? Well, first of all, you can see in this Honolulu Heart Program that the lower your cholesterol is, the greater your risk of dying. The lower your cholesterol is, the greater your risk of dying. So what they said was long-term persistence of low cholesterol concentration increases the risk of death. The earlier the patients start to have lower cholesterol, the greater the risk of death. So why in the world is the US FDA encouraging us to start giving our children these drugs. It's absolute insanity. Well, that's sort of the point about the drugs. There are many reasons we need cholesterol. It's used to waterproof our cells. It repairs injuries, including scars. It makes vitamin D, makes bile. It's for mineral absorption. It's an electron, antioxidant electron donor. You have to have it to make serotonin. You have to have it to repair your brain, etc. Remember this. All nerve cells are 50% cholesterol by weight. So if you're going to keep your brain and spinal cord and your retina and your eye working, you need lots and lots of cholesterol. If you want to guarantee that somebody cannot keep their brain repaired, put them on statin drugs. There's no way you can keep your brain repaired if you're taking these drugs. When I see patients with macular degeneration, I tell them, as long as you take statin drugs, I can never fix your macula because it takes a lot of cholesterol to make new cells in your retina. And so you must come off of these drugs if you want me to get your vision back. Well, one of the things that you see about these drugs is that they disrupt the production of adrenal hormones, they give you blood sugar problems, you get edema, mineral deficiencies, chronic inflammation, difficulty healing, allergies, asthma, reduced libido, infertility, reproductive problems. It doubles your risk of congestive heart failure. There's a 26% increase in painful legs and hands, a 98% chance of having muscle problems, an increased risk of cancer, and all of this other stuff. So it makes you want to rush right out and get your prescription for Lipitor refilled, doesn't it? So what causes coronary artery disease? Well, I can't prove what I'm about to tell you, but let me tell you my working theory. The inside of arteries is one cell thick, and it's the endothelium is like a cobblestone street like this. So surrounding the artery is, first of all, a muscle layer of smooth muscle, and then a layer of elastin and collagen, which is designed very much like a cargo net. The reason the artery is designed this way is that the smooth muscle must either get smaller or larger to adjust your blood pressure. So the muscle contraction or relaxation helps adjust you and keep your blood pressure in the normal range. But as you know, smooth muscles are very weak. Any of you that ever cleaned a fish or a chicken or other sort of thing and you're cleaning the intestines out, notice how easily they break and rupture because they're smooth muscle, right? Smooth muscles are weak. Well, because these smooth muscles are so weak, they're surrounded by this cargo netting, which allows them to enlarge a bit, but not too much. Because what happens is if the artery dilates too much, it opens up a wound like this. And here you can see what's called a fatty streak. You can see here's a swollen cell, here's another endothelial cell, and you can see where the wound is opened up and it's beginning to put down a scar, which will become a plaque because it's opened up a wound in this single cell thickness of endothelium. So in my paradigm, coronary artery disease and other coronary arteries occurs when the cargo netting that's around the artery, called the adventitia, fails. Now this is made up of, as I mentioned, elastin, and collagen. So what damages that? Fluoride damages collagen any place it finds it. Fluoride is perhaps the most active element on the entire periodic table. Fluoride is so active that if you bubble it into water, the water will actually burn if you light it. So fluoride is extremely destructive of collagen. And so we really didn't start seeing a lot of coronary artery disease in the United States until we began the process of adding fluoride into our environment. If you look at the incidence of fluoridation of water in every county in the United States, and that information is available online, and begin to compare it with the incidence of coronary artery disease, you'll see that the lines are very similar. So fluoridation or fluoride is destructive of collagen every place in the body, not only around your arteries, but in the ligaments that hold your back together, the ligaments that hold your joint together, etc. And so one of the major inhibitors of the collagen is fluoride, but fluoride also inhibits thyroid function. Now, so basically, what you see is this correlation between the use of fluoride and coronary heart disease. Now, there are other things involved, of course, with heart disease. One of them is zeta potential. Zeta potential is a magnetic field that surrounds a particle. It's very important in the paint industry because if the pigments in paint clump together, then when you paint your wall, you just got big clumps of pigment separated by just water or oil in between. So the paint industry has to pay a lot of attention to the magnetic field around the pigment. Well, our red blood cells have a magnetic field around them, which, as long as it's adequate, keeps the red cells from getting together and clumping together. But as voltage drops, the zeta potential or the magnetic field drops, and thus the red blood cells tend to get together and begin to clot. So if you look at a plaque in a artery wall, what you see is that the scar that you see inside is minimal, but most of what you see is all of this inflammation going on out here where the adventitia has failed. So again, my personal theory and working paradigm at coronary artery disease is that it's caused primarily by failure of the adventitia, and that the main things that make the adventitia fail are fluoride and hypothyroidism. And so it's very difficult to get fluoride out of the body. It's such an active element. There are two ways that I try to get it out of people. One is to use boron. Boron is the only thing I know of that will take fluoride out of the tissue. So I give people 9 milligrams of boron at bedtime each night. Boron has a lot of other good things about it. Boron is an antifungal. Boron will help inactivate heavy metals. And so it has several different things that it does that are good for people. In addition, you have to correct iodine levels in order to, because iodine does compete with fluoride, even though fluoride on a 1-to-1 atom basis will push iodine out of the way and take its place. Well, enough of that for now. Let's talk about a few other issues before we stop for the evening. Yep. Well, the short answer is I think they're wrong. The longer answer is that, first of all, the China study was not a controlled study. It was an epidemiological survey. And there's a big difference between those two, I think you'll agree. What Campbell did was he simply looked at people over there and said, "Hell, you guys don't have as much heart disease, and let's look at your what you eat, etc." There are so many factors that he didn't include. So, for example, they appear to have more iodine in their environment. Plus, the Asian people tend to consume a great deal of iodine. The average Japanese, for example, eats 12.5 to 13 milligrams a day of iodine. And the Japanese have the least cancer of anybody on the planet. So it could simply be that the results of how how much disease that they had is not because so much of the fact they weren't eating red meat and so forth, but rather that they were consuming iodine. You see what I'm saying? So the epidemiological study that Campbell did is just that. It's a survey, but not a study. Now, as far as Dr. Esselstyn is concerned, it's basically some of the same business. What you cannot do necessarily is say that let me say this a better way. A great problem with science, as we know it, is that we try to isolate something and get rid of all the other factors and say, okay, this factor does or doesn't cause this problem, right? Isn't that what we do? But that's not the real world, and there are so many interactions within the way things work that we often draw erroneous conclusions. So let me just show you an example of that here. Let's see. 2013, that should do it. One could easily say that, let's see if I can find these slides. Maybe not. Maybe it's not in this series. Bear with me just a minute and I'll find the slides I want to show you. Here we go. All right. So, the human is designed to never, ever absorb proteins. Did you know that? You must only absorb amino acids. Now, there are a variety of reasons that this is true, but it's impossible for you to be healthy if you absorb proteins. And one of the reasons is that the way we're designed to work is that when we eat a protein, stomach acid breaks it into amino acids. The amino acids go downstream and get absorbed, and then we make our own proteins out of those amino acids. And the reason that's important is that it's the only way that our immune system can function. So what happens is that behind our sternum and cozied right up to the side of the heart is the thymus gland. And the thymus gland contains the database of all of the proteins that are you. So when you make white blood cells, the white blood cells go through the thymus, the database gets downloaded into the white cells, and then the white cells go cruising around the neighborhood looking for proteins. And it bumps into one and it checks to see if it's in the database, and it says, oh, you're me, have a nice day, and it goes on to the next one. It says, uh-oh, you're not in my database. You're a virus or a bacteria here to hurt me. And so it calls in the immune troops to build antibodies, and the antibodies try to destroy that protein, and if it can't destroy it, it stuffs it in a fat cell trying to protect your body from it. So when you eat a protein and you don't have enough stomach acid to make it to break it down into amino acids, that whole protein goes downstream and gets absorbed, and you build antibodies to it, and so you become allergic to everything you eat. And so what happens is that somewhere around 20 to 40 minutes after a meal, you have a mini case of the flu because your immune system is attacking everything you just ate. Now, some people don't recognize the fact that we are only allergic to proteins where we almost never get allergic to amino acids. Secondly, that things we think of as carbohydrates all contain an identifying protein. So at the end of grain is a protein called gluten or gliadin. When we eat bread, grains, etc., and we don't have stomach acid, then the gluten doesn't get changed into amino acids, and so we develop antibodies against gluten, and we become gluten sensitive. Gluten sensitivity is no more than no less than lack of stomach acid. So the same is true for fruit. A raspberry has a different identifying protein in it than a cherry or a banana or a grape or a pear or anything else. So even the carbohydrates have identifying proteins, and when those don't get broken down, we become allergic to those as well. So the point is that without stomach acid, you will always become allergic to everything that you eat. Now, in addition to the problem of becoming allergic to everything you eat, is that stomach acid is actually in control of most of your digestive process. So, first of all, to make stomach acid requires 5 things. It requires vitamin B1, iodine, zinc, salt, and the voltage to make it. Okay? Vitamin B1, iodine, zinc, salt, and the voltage to make it. Now, again, I mentioned that in the American population, in the U.S., some estimates are that 90% of the population is iodine deficient, 80% of the population is zinc deficient, etc. And, of course, many people are deficient in voltage in that circuit. Now, one of the paradoxes about zinc is that you can't absorb zinc without stomach acid, and you can't make stomach acid without zinc. So you're caught in a catch-22. I've never ever seen a person's zinc levels normalized using zinc tablets. You have to use zinc liquid, and you have to give something like apple cider vinegar with it, or it won't be absorbed. Well, there's this confusion and controversy about eating and drinking alkaline foods and water. People say, well, you should never drink water with your meal because the water will just dilute the stomach acid. No, that's not the way it works at all. They say if you drink alkaline water, then again, it neutralizes your stomach acid. That's not the way it works at all. And the reason is that no matter what you put in your stomach, you can put a marble in your stomach, and the stomach will try to go to a pH of 2, which is plus 286 millivolts. It does that by making a molecule of hydrochloric acid, which it inserts into the stomach. But every time you make a molecule of hydrochloric acid, you simultaneously make a molecule of sodium bicarbonate. Sodium bicarbonate is electron donor. And so the increase in voltage of your blood is because of the sodium bicarbonate that you make, not from the water that you drink or the alkaline food that you ate. You see that? So the way things work then, you start putting stuff in your stomach, and if you're capable of doing so, you'll make enough hydrochloric acid to get you down to a pH of 2, which means you've made and stuffed a whole bunch of sodium bicarbonate into the blood. Now, the next thing that happens is that the stomach acid has to go into the small intestine, where the small intestine has to go to a pH of 8. pH of 8 is minus 57 millivolts. It does that by the pancreas making sodium bicarbonate, but every molecule of sodium bicarbonate the pancreas makes and stuffed into the small intestine, it makes a molecule of hydrochloric acid. So if you have plenty of bicarbonate up here to neutralize the hydrochloric acid down here, again, if you make enough bicarbonate up here to neutralize the stomach acid down here, everything's happy. But if you didn't make bicarbonate here because you didn't have the raw materials to make hydrochloric acid, or heaven forbid you're taking a proton pump inhibitor so you can't make hydrochloric acid, then when you get down here, the pancreas is making bicarbonate, and its thanks for doing so is that it gets filled up with hydrochloric acid, which makes the pancreas very unhappy. Now, do you understand what causes pancreatitis? Filling the pancreas up with hydrochloric acid. So, the point is then that the control of this whole mechanism revolves around your ability to make adequate amounts of hydrochloric acid. Now, there are other things that are important besides that, and that is that when the stomach acid hits the small intestine, it tells the pancreas to secrete several different hormones. One of those is gastric inhibitory protein, which slows the release of acid, secretin, which stimulates the pancreas to release the bicarbonate into the small intestine, and cholecystokinin, which tells the liver to make bile and the gallbladder to squeeze bile into the digestive mix. It also tells the pancreas to make GABA, and of course GABA is the sedative hormone in the brain. So if you're anxious all the time, it's likely because your pancreas isn't making enough GABA. Did you know that 80% of the neurochemicals are made in the abdomen, not in the brain? Yeah. So it also makes neuropeptide Y to regulate gut motility, and also suppresses glutamate, which makes you anxious. And it affects associative and spatial learning and memory. So let's go back for a moment to cholecystokinin. Chole means gall, cyst means bladder, kinin means to move. So cholecystokinin is, hey, gallbladder, squeeze. All right? So the signal that tells the gallbladder to squeeze and the liver to make bile and put it into the gallbladder happens when stomach acid hits the small intestine. No stomach acid, no cholecystokinin. No cholecystokinin, no bile. No bile, then you can't absorb the fats that you need to make cell membranes. And, of course, you'll become deficient in your fat-soluble vitamins A, D, E, and K. Now, remember, we started this discussion understanding that chronic disease occurs when you lose the ability to make new cells at work. Remember that? So what's the inside of cells made from? Amino acids. Except for the nervous system, which also are 50% cholesterol. So what's the body's source of amino acids? Stomach acid breaking proteins you eat into amino acids. So if you don't have stomach acid, you can't make inside of cells. What's the outside of cells made of? Fat. Phospholipids, namely. And what allows the body to absorb fat and make phospholipids? Stomach acid telling the liver to make bile. Because without bile, you can't absorb fat. So no stomach acid, no amino acids. No stomach acid, no fats. Begin to see how lack of stomach acid affects your ability to keep your body healed by making new cells? Yeah. So the point is that one cannot be well unless you make stomach acid. So if you were in a Batman movie and you're the villain and you want to destroy a population but not get blamed for it, all you have to do is put them on proton pump inhibitors and statin drugs and get out of the way and watch them become the most depressed, most tired, most mentally incompetent, most overweight people on the planet. Exactly what's happening to us, right? So you couldn't design a better way to make people sick than to put them on statin drugs and proton pump inhibitors. Yeah, when you have your gallbladder removed, you must eat bile or take a bile in your capsule every meal that you have the rest of your life. Unfortunately, your surgeons never tell you that, do they? But there are tablets or capsules that are available that have the appropriate amount of bile in them, and you should keep them, one at bottle at home, one in your car, one at work. So every time you eat, you can take the capsule with you. You take it with it. Yep. Now, the other thing is that when stomach acid hits the small intestine, it sends an electronic circuit up to the gastroesophageal valve to close it. Okay? So stomach acid is what tells the valve to close so you don't have GERD. So it's inadequate amount of stomach acid that causes people to have GERD rather than having too much stomach acid. Because if that valve is sitting open and then you start sloshing hydrochloric acid around in your stomach, some of it's going to go up in your esophagus and you're going to say, ooh, that burns. And then you belch and you taste stomach acid and you say, oh, I got too much stomach acid. Where's my Tums, right? So the way you fix GERD is to increase the amount of stomach acid so that you get the appropriate amount of electric current going up to shut that valve. Now, a guy named Nordenstrom in Sweden did this interesting little experiment that showed how this works. He took a container and filled it with a solution similar to stomach acid and one similar to small intestine. And he put an electrode down in each one of them and connected those through a light bulb, and then he had a tube with a valve in it. So again, stomach acid, small intestine, tube with a valve, electrodes running through a light bulb. When he opened this valve so that the stomach acid and small intestine could mix, light bulb lights up. That's how you get that current that goes back up to the gastroesophageal valve to close it. So one of the things that one can do while you're getting the nutrients corrected so that you have enough stomach acid is you could take betaine hydrochloride or you could take apple cider vinegar. Either work. So that after your first bite or two of stuff you put into your stomach, take a couple of betaine or a tablespoon of apple cider vinegar, and that will begin the process of breaking down your proteins into amino acids until you have time to correct your B1, iodine, zinc, and salt and voltage things so you can make stomach acid the way you're supposed to. In my experience, it can take anywhere from 4 to 6 months to get a person's iodine levels back to normal and get your bucket full again so that you can function the way you were designed to do so. So, 34-year-old female develops fibrocystic breast disease and polycystic ovaries. She also has GERD and was placed on Prilosec. 2 years later, she has a gallbladder pain and panic attacks. She also has insomnia and is unable to go to sleep until after 11 p.m. She develops osteoporosis and bloating. She is angry a lot and gets a divorce. What's the base cause of all of this? Iodine deficiency. All of that stuff's caused by iodine deficiency. So iodine is the truck that moves secretions from inside the cell to outside the cell. How many cells in the body secrete something? Almost all of them. But certainly fibrocystic breast disease is nothing more or less than iodine deficiency. You take a woman with fibrocystic breast disease and put her on 12.5 milligrams of iodine a day and have her paint her breasts with Lugol's iodine. In 6 weeks, the fibrocystic breast disease is all gone. It happens very predictably. In addition, anytime you have a cyst of any kind in the body, it's because those cells were unable to get their secretions out, and so they made a cyst. So cysts in the body are basically iodine deficiency. GERD, she had GERD because she doesn't have enough stomach acid, because she doesn't have enough iodine, so she can't close the valve. And of course, they put her on Prilosec. Now she's on Prilosec, she has no cholecystokinin. Cholecystokinin doesn't tell the gallbladder to to dump. So it just sits there and forms stones. So now she has a gallbladder pain. And in order to make the hormone adrenaline requires the amino acid tyrosine. Where do you get tyrosine? Stomach acid breaks proteins into amino acids, including tyrosine. So no stomach acid, no tyrosine, no adrenaline, and so she has panic attacks. She also has insomnia and unable to go to sleep until after 11. Well, every organ in the body has a specific time of day in which it heals itself. And so the parasympathetic system functions from up to about 9 o'clock, and then from 9 to 11 sympathetic. So if she's in a panic all the time, she won't be able to go to sleep until after 11 because she's stuck in sympathetic on. She's angry a lot and gets a divorce. Well, that relates to adrenaline. You know, the adrenal glands are two separate glands and should be thought of as two different glands. The outer part of the gland makes cortisol and aldosterone. Cortisol, of course, has to do with inflammation and blood sugar. Aldosterone has to do with systolic blood pressure because it controls the amount of sodium and thus water that you retain. The inside of the adrenal glands makes adrenaline. Now, when you become deficient in adrenaline, the following slippery slope begins to happen. First of all, you have trouble dealing with stress. Next, you have trouble with your memory. And then you can't multitask. So you're sitting reading a book and somebody says, "Hey, do you want mustard or mayonnaise?" You become angry because they interrupted you. But you don't have enough mental horsepower to keep your mind attached to your book and to figure out which one you want. So you break free from your book, you decide whether you want mustard or mayonnaise, you go back to your book, and now you can't remember your place, so you're even more annoyed than you were before, to the point of anger. Then eventually it gets to where you can't stand any stimulus. So you hate loud music, you can't stand loud noises, you can't be around a rowdy crowd, and you can't be around people who are arguing. Next, it gets to where all you want to do is sit in a corner and have people leave you the heck alone. And then your sexual equipment quits working. All of that is due to lack of adrenaline. And so many people get on that slippery slope, and many of you here in this audience are somewhere on that slope. And the problem is that when you don't have enough adrenaline, and that every time somebody wants to interact with you, you get snippy at them or even yell at them. And if you don't like to be touched and your sexual equipment doesn't work, it creates real problems within a marriage too, doesn't it? And so what happens is that a person who is deficient in adrenaline is not a good spouse, is not a good parent, is not a good kid, is not a good friend, is not a good worker, because in all of those situations, people want to interact with you, don't they? And you get angry and just simply can't deal with it when they try to. And so your whole life falls apart. And it falls apart because you don't have the things necessary to make adrenaline. So what are the things necessary to make adrenaline? The amino acid tyrosine, vitamin C, and vitamin B6. What's the body's source of tyrosine? Stomach acid, right? You eat a protein, breaks it into amino acids, including tyrosine. So if you don't have stomach acid, you will become deficient in adrenaline, and your life will get flushed down the toilet. Any protein. So I see this day in and day out in my office. People come in, and they usually don't talk about exactly what I just told you, but I have a questionnaire that I give everybody, and if you want to take the hormone questionnaire, it's on my website, tenantinstitute.com. Go to where it has registration papers, and within that is the hormone questionnaire, and you can score it. Any score over 20 means you're likely deficient in that hormone. But people come in and I see a high score on their adrenaline questionnaire, and I start saying to them what I just said to you. This is what happens when you don't have enough adrenaline, and the tears start coming down their eyes, because usually this is the first time that anybody has recognized what they're going through, and that anybody has said, this is not because you're emotional, you're emotional weakling. This is because you don't have adrenaline, and it's easy to fix. Tyrosine, vitamin C, vitamin B6 for a few months while we get your stomach acid going again, and you get your life back. So it's very powerful to understand the role of stomach acid in health and disease. Well, tyrosine I usually give about 1,500 milligrams a day. You can take it all at once, or some people can get a little jittery if you do, so you take it 500 with each meal. Vitamin C, I usually do the same thing, 500 milligrams with each meal, or if you like, you can take it all in one dose in the morning. B6, on the other hand, you don't want to take more than 100 milligrams a day. So that's the amount that you usually use. So my time is up, and so I hope that the comments that we've made this evening add to the comments that we've done earlier in the day about the role of voltage. What I've tried to do is today, earlier in the day, we talk about the voltage pieces. Tonight I've tried to talk to you more about the things necessary to make cells, because they're just as important as the voltage piece. You have to have the raw materials to make cells in addition to the voltage, or it doesn't work. Now, one of the things that makes me go outside my office and have therapeutic shrieks is that I'll go through a patient's history and their problems and measure everything, and I say, okay, here's the stuff you need to do. You've got to do this stuff to fix your stomach acid. You got to go do this stuff to fix your vitamins and minerals. You got to fix your nitric oxide levels. You got to get your liver cleaned up. You got to get your teeth fixed. You got to come back and let us fix your scars that are shorting out your circuits, and so forth. So they come back 6 months later and they say, Doc, I'm not feeling any different than I did 6 months ago. Well, are you still taking your iodine? No, I never started that. I wanted to just see if this extra exercise I was doing would do the job. Well, are you still taking the thyroid hormone I prescribed? No, I never got that prescription filled. Well, did you go to the dentist? No, I don't. My teeth are fine. They don't hurt. And so at this point, you could see me banging my head off of the desk saying, why are you here? Right? You understand? The point is that if you take your car and you roll it and total your car, and you decide, I have to drive this car because I don't have any insurance. So you put new tires on it and it won't run. And so you fill up the gas tank, it still won't start. Then you discover there's a hole in the gas tank, so you patch that and fill it up again, still won't start. Then you realize there's no battery, so you go out and buy a battery and put it in, it still won't start. And then you discover that the spark plugs were broken, so you put new spark plugs in, and it still won't run. And then eventually you figure out there's no steering wheel. You begin to see what happens to people. I see all the time people say, well, I'm going to do homeopathy for a while. Well, that helped a little, but it didn't work. Well, I'm going to do acupuncture for a while. That helped, but it didn't really work. I'm going to do chiropractic for a while. Same story. Or I give them this list of stuff, and they don't do the whole list. It's like trying to make your car work when you just try replacing one piece at a time. To make your car drive correctly, you have to have all of those things working, don't you? And so it is with the things we've been talking about. You can't do it piecemeal and expect to make it work. And so, although it's difficult, it's time-consuming, and to a certain degree it has some expense to it, you have to fix all of the things necessary to make new cells. You have to have the you have to have the amino acids, which means fix your stomach acid. You have to have the cholesterol, which means fix your liver. You have to have the vitamins and minerals, which means fix your fulvic acid levels. You have to have oxygen, which means fix your nitric oxide levels. You have to get your voltages normal, which means fix your teeth and fix your thyroid and clean up your liver and fix your scars. When you do all of that, the body has amazing healing power and can fix most things, as you saw with Dr. Starr's thumb. So in closing, I want to thank the Academy. It's been very kind for you to invite a non-dentist to come and share some thoughts with you. Everyone here has treated me with unusual kindness, and I appreciate that. And I hope that I was able to transmit some small bits of information to you that makes your life and your patient's life and your family's life more livable and enjoyable and healthy. So thank you very much.
Thank you, Dr. Tennant. You know, I've had the privilege, another great presentation. I've had the privilege of listening to several presentations with Dr. Tennant, and I learned something new every night that I listened. And tonight was no exception. We hope that you take something home and have learned something